Sick people across the U.S. say they are being denied the coronavirus test. Is it true? Several Texans posted they have symptoms and were denied tests today. I'm Texan and I was denied a test. So, I don't know if it's the same in Texas, but this is what happened across the border in OK today. A physician denied an individual a test. She's pregnant, so I found that even more concerning. I called the Oklahoma State Department of Health and asked why was she denied. They asked if a physician denied her, and if so, a random physician doesn't have the final say. They told me to have her call them and they would facilitate getting her tested. The entire state of Indiana has less than 100 tests. They're only trying very seriously ill people. Anyone who is sick should assume that they're positive and operate accordingly, including isolation. A positive test won't change how a case is treated clinically. Can you tell us more? A friend of mine traveled to Asia 2 weeks ago, returning this past Monday. When he got back he felt very ill, with shortness of breath and a fever. Called several doctors' offices to ask for a test and he said they all basically laughed him off the phone. In Texas, was not tested after testing negative for flu and strep this AM. Sunday felt tired. Monday headache, enough it felt like allergies but almost stayed home. Went to work because headache went away. Tuesday low fever and dry cough started. Chest started getting tight. Tuesday PM my throat was so sore and chest started getting heavy and tight. Feels like elephant standing on chest and also fire. AKA pressure and burning sensation, can't take deep breaths. Wednesday fever on and off, chest pain got worse. Thursday no fever, but sore throat / cough / chest pain / shortness of breath. Went to doctor because my co-worker tested positive for strep. I tested negative for flu and strep. Thursday PM lightly elevated temperature, chest pain staying and now phlegmy. Doctor said it's nor COVID-19 because I have a cough. She agreed it wasn't allergies as my regular sinus issues not present or post-nasal drip. Sent home and told it's something viral. I flew a week and a half ago in a city with cases get confirmed this afternoon. Pretty sure I should have been tested but who knows. 28F Oklahoma. Was denied testing 4 days ago in spite of having a 101+ fever for almost 2 weeks. Deep cough, lung pain, shortness of breath, SpO2 was 89%, heavy night sweats. Tested negative for strep and the flu. Reason? I haven't traveled to China or Italy. But I do work with and live alongside people who work with travelers from all over. Not good enough. Called back the next day because my condition worsened and was told by a nurse to stop calling or she would mark that I exhibited drug-seeking behavior because calling 9 times in 3 days was unacceptable. I'm feeling better now, just a light cough and mild fever at night. But I was sick for almost 3 weeks. It didn't feel like a usual cold because I never got a sore throat or sinus problems. It was terrifying not being able to breathe but being told I didn't matter. Had to stay up multiple nights in a row just concentrating on breathing. Still terrified I will relapse or something as I sit here with the mild urge to cough and feeling lightheaded. How are you a drug seeking when you just want a test? Responding to we can't test you unless you meet the criteria with is there anything you can do for me, I can't breathe and I am in a lot of pain. Then she tried to calm me down because COVID-19 wasn't even in the state yet. This was before the positive in Tulsa. It's been a nightmare. I've been sicker but not for this long. Hospitals and clinics around here don't respond too well to people without insurance asking for help. It's a stupid way to treat a patient even without corona hanging around. What you described can be caused by a whole range of medical issues. Oh my god, I'm so sorry. 27F here. Very similar thing happened to me. Just because we're young, doesn't mean we can't get sick. It's really pretty awful the way the medical community treats young people with symptoms. I'm a medical professional myself, and it's horrifying how much I hear other medical professionals basically laugh at young people coming in with concern for their own well-being. Like Christ, we're young, not immortal. We get sick too. Yeah, The idea that only old people can get health problems is plain idiotic. I've had chronic health problems for the past 3.5 years and I get this stupid crap all the time, about how I can't have health problems because I'm young. Guess along with gender, race, religion and caste, we can add a privilege of being old so that your health problems can be declared valid. Ironically, ageism but discriminatory against some young people. We were denied tests in Colorado. I've had a temp of 102 and coughing, nausea and chills. Bedridden for 3 days now. I haven't traveled but my wife has. Never had flu before and got flu shots this year. Just seems like too much of a coincidence. Exactly the same symptoms. I'm on my 5th day. It started when I came back from DC. The test was denied in CA. They told me they will test my when I will start suffocating. I don't want to reach that point. Can confirm. Went to the ER with flu-like symptoms today, fever, chills, dry cough, extreme fatigue, which have persisted for about 5 days. The doctor came in wearing a plastic face shield over another N95 mask as precautionary measures in the event I had COVID-19. Doc explained that the hospital is not actively testing anyone that is not high risk, or is not exhibiting signs of pneumonia. He disagrees with the principle, but can do nothing to change it at the moment. He did not comment on the number of tests the hospital has on site, but I imagine they do not have many. There are cases immediately north and south of my county, but none currently reported in my immediate municipality. We are on the I-5 corridor, and see traffic from Washington and California daily. I left the hospital today with a vague influenza diagnosis, a mandatory 3 days off work, unpaid, an inhaler, and a recommendation to return if my symptoms worsen. That's it. Richest country in the world and we can't afford tests for sick people. What a time to be alive. Coronavirus. As South Korea tests 20,000 people a day, USA has tested 11,000 in total. It won't be just tests. Trump next week, we have all the beds and ventilators we need. Millions. Beautiful beds. Best in the world. CDC next week, our hospitals are full. Only 11K tested in the whole USA, are you kidding me? European speaking here, US people be prepared for everything. That virus is some serious shit. I think you will get hit harder than the rest of the world. Edit, just to give you some more numbers to compare. Germany did over 35,000 tests over the last week, not including clinics. Clinics do 100 tests/day and we got 2,000 clinics in Germany. US policy appears to be, don't test, don't tell. WTF is up? No travel restrictions were implemented for weeks. Schools are still open. We are being urged not to wear masks. Only 11,000 ppl tested thus far out of 331,000,000. Almost as if they want everyone to get coronavirus. No shit. The CDC in Virginia declared they have only 500 tests available for the entire state. Link. Epidemiological criteria for coronavirus testing. 1. Be a wealthy celebrity. 2. See criterion number 1. Step 1. Be rich. Step 2. Don't be poor. To be fair, some of those wealthy celebs got tested in Australia where the healthcare is better. But they only had 500 cases and then it suddenly stopped spreading. Nothing to worry about. Having more people tested would decrease the fatality rate, seeing that even people with mild symptoms or no travel history could be tested. I can't understand why anyone wouldn't want that. It would be reassuring. Because it's bad for the economy and it's not a secret that some people prioritize money over health. South Korea versus most EU countries. It's like the TV show Chernobyl where radiation level reports were capped because the Geiger counters only went so high. Once the US starts really testing, I wouldn't be surprised if we're the next Italy. Imagine what it's gonna be like in 2 weeks. It's gonna spread like wildfire. By next weekend, at the latest. The next 7 days are going to be a rough wake-up call. Everyone at Walmart had full carts just now, no toilet paper. I was just topping off my already stocked food supply. Good luck to everybody. The UK government estimates there might be 5,000 to 10,000 people infected, yet they are not closing schools or forbidding sports events and concerts. They may surpass Italy first, who knows. Local hospital I know in the city is currently only allowed to run 4 tests a day. 4. This thing is just spreading so rapidly and will absolutely explode when mass testing becomes available. I live in Pittsburgh. Our county says they won't test anyone unless they come in contact with a known case or if there are other cases in our area. Quite literally, they won't test based on symptoms alone because they have no confirmed case. It's the most bullshit catch-22 I've ever heard of. Like, here's my theory: the virus has already spread a lot and we don't even know the tip of the iceberg. So you're going to have people getting infected by people that don't know they are infected. America is going to get fucked so hard. So very hard. Well, I mean, they are failing the questionnaire. 1. Do you play a professional sport? 2. Are you rich? 3. Do you know where the exit is? Houston, Texas here. My husband left the ER this morning because of high fever, hallucinating/passing out feeling, flu-like symptoms, trouble breathing, cough, and he was denied a test. Had 2 flu swabs in the past 2 days and both came back negative. Husband was discharged with flu-like illness. No warning of self-quarantine, and nurses were joking about the virus every chance they got. I've been calling his physicians and the local county hotline to try to get him tested, and they say he doesn't meet criteria. Seems like others are getting tested because they've traveled. Looks like traveling is the golden ticket. Even though he has a weakened immune system due to a pituitary gland disorder and he's a first responder that is around EMS personnel on a daily basis, the health officials don't seem to care. This is a shame. A total shame. I just got the test done and my doctor said congratulations, as I was the first person they have had to meet the qualifications to actually get the test. Edit: this was at a major hospital. I hope it's negative, but also hope you feel better. Aw, thanks. I hope so too. When do you get your results? 2 days-ish. What? I thought it was a few hours. Are they sending it out somewhere? You have to be a rich, professional athlete to get the MVP 4-hour results test. If I get sick enough to where I think I need to go to the ER, you can be absolutely sure I'm going to tell them I just arrived back from a tour across Asia and then went to the CPAC conference. Fuck this. Give me the test. I have a credible source at Hinsdale Hospital, Chicago suburbs, that told me today the doctors have requested testing for 55 patients and the health department denied all of them. The Illinois Department of Health? Why? I don't understand this. What is the bottleneck here? This is insane. Not op but Pritzker, Govaville, was on CNN yesterday saying there's only around 1,000 tests for the whole state because the feds haven't allowed states to develop and distribute tests themselves, so the state health department's hands are tied at this point. Guess you can't be positive if you don't get tested now. I understand Pence's strategy. I live in Pence's hometown. My parents' next door neighbor, some fucking hound for some fucking reason, got back from Paris yesterday. He has a fever, is coughing, overall feels like he's dying. He's called the Department of Health, his doctor, all the local hospitals. All of them have told him no to getting a test. But also living in Pence's hometown, they are having a game night and fish fry in that same house tonight, with a lot of people still going because a lot of people are sticking with the hoax fear-mongering theory. I hate living in this town. Oregonian here. The urgent care center refused to see me due to the nature of my symptoms and requested that I go to the ER. Denied a test at the hospital, because I was not deemed high risk, nor was I expressing any symptoms of pneumonia. I live on the I-5 corridor, and frequently interact with tourists, travelers, and home-free folks at my place of business. Sent home with a vague influenza diagnosis, an inhaler, and 3 days mandatory work leave. Edited for clarity. Urgent care diagnosed me with upper respiratory infection Saturday and then pneumonia Monday. Doctor today told me to go to the ER because of worsening symptoms. ER told me I can't be tested because my temp isn't high enough and I haven't come into contact with anyone who's tested positive. We have no evidence of community spread. Maybe because no testing is being done? I was told to go back to work tomorrow if I want because I'm fine. Meanwhile I'm in bed struggling to breathe. I'm one of these people. I came back from northern Italy and had flu symptoms 2 days after coming home. I contacted my hospital, and my doctor essentially told me to self-quarantine and not to bother coming to the hospital since the CDC wouldn't run my test. I'm on day 12 of quarantine, feel a lot better, but this is insanity. I came back from the outbreak zone, had symptoms consistent with the virus, and my doctor told me essentially to not waste my time. I work in healthcare, and luckily my employer has been very accommodating. But our government's response has been a joke thus far. I'm a nurse in Texas and tests are in very short supply. I work for a major hospital and we still have to go through multiple state-level steps to get testing. It's not like we have a swab hanging out in the back that we just don't want to give you. We would love to test everyone with symptoms, but it simply isn't possible right now. Thank you for this post. I went to the doctor for a strep test today. BC my husband tested positive, and told her my worries about COVID. I didn't ask for a test, was just curious about the situation. She said their office doesn't currently have a way to test. She looked stressed and worried. I worry that patients blame the people on the front line. It is not their fault. This is a situation that they cannot control. Best of luck to you. What do you think about this situation? Leave a comment. And subscribe to this channel if you want to see more same videos.